Embracing the compassionate side of healthcare allows children the opportunity to fortify their longevity and place their indelible imprint on the world. For Thomas Dahlborg Sr., he's on a mission to transform healthcare into health caring, amplifying positive childhood experiences for all children. Dahlborg is an accomplished author and the executive director of the Michigan Center for Clinical Systems Improvement. It's a nonprofit organization and quality improvement consortium which partners to better care. It convenes payers, health systems, health, and other healthcare stakeholders to measurably improve the quality of health care. Dahlborg joined me this week to have a discussion about his important work of advancing the healthcare system forward for children and his anti-bullying efforts through his written word. I'm Kevin McShann. Let's have this conversation. If you're ready, I'll take a moment to welcome you to the show, and I'm excited to talk to you today all about your work in healthcare. Great to see you this afternoon, and thank you so very much for being here.
Again, thank you so much for the invitation. I'm looking forward to learning and sharing with you and your audience.
Absolutely, and now Tommy, I want to hear all about your work in healthcare. I know that you're on a mission to transform healthcare into health caring and to make sure that children have a positive healthcare experience. So I'm wondering if you can tell me all about it.
Well, I can give you some highlights. So first of all, my day job is working for the Michigan Center for Clinical Systems Improvement. And what we do is we partner to better care. We partner with health systems. We partner with payers. And we are seeking to improve care for all people throughout the state of Michigan and then carry that forth beyond the state. We use evidence in everything we do. We bring heart and mind to everything we do. We focus on measuring those things that can be measured. And we ensure that body, mind, and spirit patient focus is key. And we're positioning health systems and people who work in healthcare, those heroes of healthcare that we hear about so often, are well positioned to connect at all those different levels. So that's really the day job with MICSI, or the Michigan Center for Clinical Systems Improvement. And then through my work with the Dahlborg Health Caring Leadership Group, I do a lot of in healthcare, but also to your question about positive childhood experiences, I do a lot of work in the bullying space and addressing adverse childhood experiences and really seeking to mitigate the adversity that children have faced by bringing in more positive childhood experiences and partner with people around the country in doing so.
Yeah, fantastic. And I know for people that work in healthcare, certainly the coronavirus has been a big topic of conversation. It's affected all aspects of our healthcare system, as you know. So I'm curious to get your perspective on what's the biggest impact you think it's had on our healthcare system and our kids in general?
Well, I think that if we want to call it a silver lining, for lack of a better term, I think one of the silver linings is that the pandemic has shown a light on both the goodness, the flames of good we need to fan within healthcare. And it also has shown a light on those opportunities that we must fix, we must address. We have one physician per day in America committing suicide. And of course, that exacerbated when you think about worldwide statistics. We have nurses leaving the system because they're burnt out. We have healthcare leaders that have lost their way and are focused more so on the bottom line than on the care of their care teams, and of course on patients, families, and communities. And of course, we have the other side of that. We have brilliant people, caring people, loving people, seeking to do much, much good under incredibly challenging circumstances, hence, like we talked about with the pandemic. And now, specific to children, what the data is showing us from the pandemic is that a lot of these well-intentioned mitigation efforts to keep children safe, which is what we should be focusing on, have actually had some unintended and adverse impacts. So the increase in depression, anxiety, the suicidal ideation, and the actual suicide numbers for children has increased during this time. And you see more and more research coming out about, we need to think differently. We need to have, yes, infectious disease scientists, physicians at the table, and we need to have child psychiatrists, psychologists, counselors, and others. We need a full 360-degree lens of people at the table so that when we make well-intentioned decisions based on as much good evidence as we have before us, we're understanding the intended and unintended consequences, and then can address, modify, change, evolve our thinking as we go forward. So I think the pandemic has been horrific in many, many ways, and has provided us with a phenomenal opportunity to make things better.
Absolutely. Every opportunity provides an opportunity to make a difference, doesn't it?
It certainly does. It certainly does. And we need to remember that. So we need to have sorrow and sometimes get angry and so forth. And we need to be grateful for the opportunities to still be in the game and still seek to make things better.
That's the evolution of life, isn't it? It comes on every angle, and we don't know when it's going to hit. So it's important to be nimble, isn't it?
Yeah, nimble. Yes, I like that a lot. I've used the term agility a lot, and more so under these current circumstances. So yes, we must be nimble. We must be humble with that, and be nimble, because the more we get set in our ways.
Can you hear me? 1 second.
We need to change.
Yeah, I'm gonna ask you to repeat that, buddy, because I think we lost sound. We were talking about being nimble and the importance of being nimble and the importance of being able to adapt.
Yes. So to that point, so I use the term agility a lot, especially more so because the pandemic and other challenges have necessitated our need to be nimble, to be agile. And I would simply say, on top of that, we also need to be humble. And I think when we're both humble and nimble, we can do some really cool things, because if we go to that place of hubris, where we believe the decision we made, if we change direction, we're going to look bad, or we're going to look like we don't know what we're doing, that only does more harm. However, when we're humble, then we can even more so be nimble, because we can recognize, maybe I made a mistake. So now I'm going to change and make things better. I'm going to learn from it. I'm going to fail forward, as a good friend of mine at IHI would say. So it's really that nimbleness and that humility that really will position us to move forward and make things better for others.
Yeah, 100%. And Tom, as you told me earlier, one of your passions is also making sure that we eradicate bullying as best we can. And I know you've written a book called The Big Kid. So I'm wondering if you could tell me about the book and your work and the importance you place on trying to eradicate bullying as well.
I am happy to. Yes, The Big Kid in Basketball is a book I wrote. I actually wasn't intending to write it. I was actually journaling because of an experience or experiences my son and I were having, our entire family. He was being bullied, and he was predominantly being bullied by adults, by coaches, and so forth. And as I was journaling, I started creating a blog. And then eventually I wasn't publicizing it, but people started to read it and they said, you need to write a book. So I wrote a book. And most recently this year, I wrote a second edition of the book, The Big Kid in Basketball. And what I learned through this journey was that, number one, children are being bullied more by adults than we could ever imagine. I worked years ago for the National Institute for Children's Health Quality, and I leaned into experts, and they shared that my bride and I, we weren't alone. These, again, children are being bullied by adults to I believe it's 47% of children are bullied by coaches, as an example. And so I wrote the first edition of the book, and it got all this press, and I was speaking around the country and beyond, and I'm on newscasts and so forth. And then, Kevin, not too long ago, and let me say it this way, Tommy started being bullied when he was 4 years old. It hit one of its peaks when he was 8. And we went through and we used sports and basketball as a tool to help him or help us mitigate the impact of all that bullying. And so now I get all this press and so forth. And then a few years ago, Tommy comes to my bride and I, and he says, I think he was about 23 at the time. He says, I need to tell you something. When I was in 4th grade, I put a belt around my neck because of the pain I felt from being bullied. And Kevin, it just, of course, it broke our hearts, but it also reminded me of, again, going back to that point about being humble. I clearly didn't know as much as I possibly thought I knew. And I knew that I needed to learn far more if I wanted to help more and help more kids. And, thank God my son did not move forward with suicide. However, there are many, many, many children who have, and even more so during the pandemic, as we just talked about. And so I wrote the second edition of The Big Kid in Basketball with additional expert insight from experts I reached out to help more, to help people understand what they should do and what they shouldn't do to help children, to stop bullying and to mitigate its impact, to decrease the impact of the adverse childhood experience of bullying and increase the impact of positive childhood experiences. So clearly it's close to my heart. My son and I and my bride and my 2 daughters, we're in it together, and we're partnering with people like Lisa Koval, who I met through my healthcare work. We're partnering to stop bullying in the Vietnamese community. And I'm partnering with folks in the baseball community. Even though the book is about basketball, it translates well beyond. And so we're working with within this baseball space and many, many other areas because it's that important. And our kids, we need to care for them. We need to love them. And we need to do it both with good intention, which is our heart, and also right action, which is our mind.
Yeah, absolutely. And I have to tell you, as you know, Tom, I'm personally connected to your son, Tommy, and I have to tell you, I think he's spectacular, buddy.
Thank you, and agree wholeheartedly. And I think that sometimes a child who's bullied and abused and so forth becomes a bullier and an abuser. And Tommy went the opposite way. He has used his experiences while he's seeking his own help, while he sees a psychiatrist, while he sees counseling. He's using his own experiences to break down the stigma around mental health, to break down the stigma of boys and girls and others seeking help, because we all must learn that to be courageously vulnerable, to be brave, it's good, it's right to ask for help. And he's doing a phenomenal job, as you know, in that space.
Yeah, I know. He hosted a podcast for a while, which I was honored to be a guest on as well, Tom. And I'm curious to know, for you, what's the biggest and best lesson you've learned from Tommy? I'm curious.
Oh, it's interesting. He's so self-reflective. He's so always looks inward and asks for help about, so what are these things? And he asked our entire family, and I'm sure others, just like you asked me, and this was in the past few days, what have we learned from him? And I can tell you, just because it's top of mind, one of the things that I learned from Tommy, and he always saw it as a negative. And I realized just after he asked me the question, I processed it. That's actually a positive. Tommy's one of those people who he might start something, but if he realizes it's not right or the right thing for him to be doing at this moment, he'll change. And he saw that as a negative, that he doesn't stay with things. And what we realized, and we had this conversation, and it was funny, my daughter also said something similar to him, was that he has the guts to say, yep, I tried something, it didn't work, or at least it didn't work for me at this moment, and I'm going to turn my passion elsewhere. And we reframe that. So we reframe that, and I now have learned that I also have that freedom to do the same thing. I may start something, maybe it's my next book, and I might realize that it's not the right direction. I need to reframe it or turn it in a different direction. That's okay. It's okay to do. So that's just the most recent thing I've learned from Tommy. But throughout my books, you can read more and more about lots and lots of lessons he has taught me.
Yeah, absolutely. And Tom, as you know, I was born with spastic quadriplegia cerebral palsy. It just simply means that I don't have enough oxygen in my legs to walk normally. So I'm curious to ask you, when we look at diversity, equity, and inclusion for folks with disabilities, whether it comes to whether it be in healthcare or other parts of societal life, where do you define inclusion and diversity and equity when it comes to folks with disabilities in healthcare?
Well, I'd like to start with a story. And the story is about an amazing woman I met when I worked for New England Deaconess Hospital in Boston years and years and years ago, before it merged with Beth Israel. And this woman's name is Susie. And we got to know each other. We got to learn from each other. We complimented each other as far as my strengths, she would compliment, and her strengths I'd compliment, and my weaknesses and her weaknesses. And I remember we used to walk the streets of Boston in the evening and go to dinner, and we'd be going up and down hills. And she always held my arm. And we had this amazing friendship. And Susie has cerebral palsy. And I remember not too long ago, we were talking about life. And because this goes back to like 1980, must have been 88, 89 when we first met each other. And we were talking about life. And she told me a story that about herself and her father. It was and when she was younger and she was frustrated. She couldn't do something that the other kids were doing. And she said her father, who was this big man, who's passed away now, but he's a special person. And he lifted her up and he hugged her. And he said to her, he said, honey, you can do anything that the other kids can do. You're just going to do it a little different. And I was just so touched by that. And she's now she's in the midst of creating a nonprofit called Just a Little Different Foundation. And it's about embracing physical freedom through play and the different ways we each do that, regardless of whatever we bring to the table, whatever challenges we're facing. And so when I knew we were going to have this discussion, I was reflecting upon that discussion with Susie, and what I learned from her through our friendship, through that discussion. Now, you asked specifically about health equity and health inequities and disparities and so forth. And I remember that looking at it, I think it was a blog you had written some time ago, or maybe it was recently, and you said something to the effect of the true definition of growth is exhibiting the wherewithal to embrace the diversity of possibilities. Mm-hmm. And as I was thinking about Susie and thinking about what you had written and thinking about my own work in my day job and working to address social influences or social determinants of health, working to mitigate disparities and improve equity across the board, and thinking about the Kaiser Foundation and how they define healthy people in 2020 and how they define it. And at the end of the day, for me, it comes down to everybody should have access to compassionate, evidence-based, and I call it health caring, and the opportunity for us all to achieve our optimal health. Now, my optimal health, because I have a lot of health issues, and that one of my books is about that, may be different from someone's optimal health, but I should have the same opportunity to achieve whatever that looks like for me, as everyone should. And so we work daily with systems around Michigan and beyond, doing that. And I reflect back on my experiences with Susie and our friendship, and growing up in inner city Brockton, Massachusetts, and the health disparities in that space, and what's happening in Detroit in the health inequities in that space, and my work with the VAs and the veterans and the challenges they face, and throughout. So long story short, we have a lot of work to do. There are great people who truly care, doing their best with great intention. There's a lot of funding right now to help in this space, and we simply need to not allow it to become a talking point, but rather it needs to be an action point. And we need to be bringing heart and getting into right action to make things better for everybody.
Yeah, absolutely. And I want to thank you for sharing that. And I'm wondering, Tom, if you can complete this sentence for me. How do you think you would measure sustainable progress in healthcare in general?
Well, it's interesting. I have a real, perhaps interesting perspective on measurement. I ran an analytics department. I developed informatics in the Medicaid space, and I've worked in quality improvement, and measurement is really, really important. And a lot of people will say something such as, if you can't measure it, you can't manage it. And they always say Edwards Deming, who's the godfather or parent of quality improvement, said that. Actually, Kevin, he never said that. And so what we've done is we've actually ruined what he really said to fix it into our mentality, into what we want it to be. What he actually said was, there are many things that cannot be measured and still must be managed. And there are many things that cannot be measured and managers must still make decisions about. There's another person by the name of William Bruce Cameron, and he said, not everything that counts can be counted, and not everything that can be counted counts. So what I've learned over my many, many years in healthcare is that as leaders and as coaches, we must evolve beyond that management 101, beyond that mentality of, if I can't measure it, I can't manage it. We need to get to that place of, we need to really get to that place of leading with heart and mind, understanding some things aren't measurable, and still we need to continue to move things forward and make things better. And so it's far more complicated, but life is complicated. But it's far more important to understand those premises if we're really going to make a difference.
Yeah, diversity of perspective is a powerful thing, isn't it?
It certainly is. And the more we have it, the better we are. And the more we shy away from it, the worse we are.
Absolutely. Now, Tom, I know, getting to know Tommy a little bit, that you and your family are huge Michigan football fans. And so the last 2 weekends must have been happy times in your household, huh?
It's interesting. So we grew up in New England. So
I can tell by the accent.
And Tom Brady, of course, the GOAT from the Patriots, and now with the Bucks. He went to University of Michigan, and my son his fiance is from the University of Michigan, and I get to, in my day job, partner with a great many amazing people from the University of Michigan. So yes, we have adopted them, or maybe they've adopted us, the blue and yellow, blue and maize of Michigan, and we're huge fans. And yes, you're right. The last couple of weeks have been really, really exciting. Beating Ohio State and then taking on and beating Iowa to win the conference. Life is good here in Michigan.
And do we think they'll beat Georgia in the playoff game?
Seeing that all those people may be listening, absolutely, Michigan will win.
Hail to the victors, right?
That's right.
So, yeah, Tom, outside of Michigan football, I'm curious, what are some of your other passions away from the office, buddy?
Well, It's diverse. So of course, family is huge, and we live about 1,000 miles from family, so we connect in a lot of different ways. And it was interesting, Kevin. I was thinking about this today. That I noticed that on Twitter, Tommy's been putting out some great content. By the way, if you don't follow Tommy on Twitter, please do. He's got great information out there. And I've been liking and retweeting and responding. And I had this epiphany. I'm like, why am I doing that? He's my son. I can communicate in all different ways. And in fact, we do. We get online and we'll do a game together with earphones so we can talk with one another. We send emails and interesting stories to one another. We of course have phone calls with one another. And then I realized that, and I would say this to anybody, as a parent, as somebody who has a child in their life that they truly love and they care about, is it doesn't matter how you communicate with them. It matters that you do communicate with them. And so that was this epiphany I had today. It's, if you want to communicate with children, do it. Just do it. Whatever, leverage technology, leverage walking next door, whatever it might be. So family's huge. And we do the same with our daughters, of course, who are amazing. And beyond that, animal welfare. So I actually created two entities. One is called The Loneliest One, and that's about encouraging people to adopt that older shelter dog. And you may have less time together, but you'll save two souls, your own and that dog's soul, as when you adopt that older shelter dog. And I also created another entity called PETS, Patient Engagement Treatment Services, which is really about connecting veterans and others with animals. And again, that shared love, that shared service, that shared caring, it elevates the world. It brings light into the world. And I would simply say beyond that, I also write poetry and have been blessed to have some of my poems published and part of award programs and so forth. So I guess that's enough for today.
Well, life is a great gift, and we have to maximize every moment, don't we?
We certainly do, which, and I know you know this, part of that maximization of life is taking that breath and looking around and being grateful and having that gratitude and also caring for ourselves and resting when we need to.
Absolutely. A little self-care goes a long way. And Tom, my final question for you this afternoon is, I'm curious about your own personal and professional legacy and how you want that to be defined.
I have a interesting relationship, kind of like with measurement as far as legacy. I've always had concerns, be it in academics or in healthcare. A lot of times we invest money in brick and mortar because we want legacy, because we want our name on a building. And I don't want that. I want to invest in people and in systems that help people be best, their best, that they can help others. So I would say for my own legacy, I just want to help make things better.
Yeah, fantastic. Helping other people maximize their fullest potential is rewarding and gratifying in itself, isn't it?
It certainly is. It certainly is.
And Tom, tell me, if people want to get connected with you, buddy, what's the best way to do that? If they want to get connected with you or purchase all those great books that you write, buddy?
So I would say a few things. One is for the book on bullying and what to do and what not to do, go to tbkid.org. So it stands for the big kid. So it's tbkid.org. If you're interested in bringing compassion and love and heart, marrying that with evidence back into healthcare, and then you would go to health-caring.org. And then if you want to reach me, I can be reached. Actually, let me give you my cell phone number. It's 207-747-9663. And then my books are on Amazon. I can be found on LinkedIn. Those are the easiest ways. And again, Kevin, I am so grateful for the opportunity to learn and share with you today.
Well, Tom, I have to tell you, I've been looking forward to engaging in conversation with you all week. I want to thank you for all that hard work that you do in the healthcare space and for engaging in conversation with me this afternoon. Your time, energy, and efforts on my behalf are most appreciated, Bonnie.
Oh, thank you, Kevin. I wish you all the best, a wonderful holiday season, and a phenomenal new year of peace, joy, and impact.